This tape is being produced for the Archives Committee of the American Association of Neurological Surgeons. It's 6 March 1992. The interviewee is Dr. Karl Pribram, who is at the Center for Brain Research and Informational Sciences at Radford University. The interviewers are Dr. Robert Keelover of the Departments of Neurology and Psychiatry, and Dr. Howard Kaufman of the Department of Neurosurgery at West Virginia University School of Medicine. Dr. Pribram has a distinguished background, going from most recent to further back in time. He was the head of the neuropsychology laboratories at Stanford University. Before that, he was the director of research and laboratories of the Institute of Living at Hartford, Connecticut. Prior to that, he was in the departments of physiology and psychology at Yale University. Prior to that, he worked at the Yerkes Laboratories of Primate Biology, Orange Park, Florida. His training was in biological sciences at the University of Chicago, where he received a BS, and then he did his medical degree at the University of Chicago. He trained in neurosurgery at St. Luke's Hospital in Chicago and was an instructor in surgery at the University of Tennessee. After that, he was briefly in private practice in Jacksonville, Florida. Dr. Pribram, obviously we have a limited amount of time and a great deal of material we could talk about, but we're interested to learn how you got interested in neurosurgery and in the basic science research that you carried out subsequently.
The story is fairly straightforward. I was interested when well, in high school, I first made a decision between going into international politics and biology, and decide on biology because I could never make an ambassador, didn't have enough money to do that. So I went into biological science and biology, and then the war came along, and so I got an MD instead of a PhD. That was perfectly straightforward. Then I was interested in the integrating systems of the body. And there are really basically two major ones. One was the endocrine system, and the other the nervous system. And I felt that maybe I could do something like biochemistry. Because I felt that that might be a field to unite biological and chemical kinds of studies. Then I found at the University of Chicago there's a whole building devoted to it, and people had beat me to it, and they were already studying biochemistry. And things like that sort of steered my course. But I did still want to go into the chemical, biological kinds of things, thinking that no way could I ever master the nervous system. But then I met Ralph Gerard, who taught me my physiology and neurophysiology, and it became so interesting that I felt that at least part of my life I would spend on the brain. John Fulton's book came out while I was studying physiology, and I gobbled it up over one weekend, and the following week we had our final exam in physiology, and I just regurgitated that book for Gerard, who said it's the best test exam papers he had ever seen in his life. He hadn't read the book yet. I really became more and more interested. Then when I was in medicine, Joe Ransohoff and I traded cases always, because he didn't like neurosurgery and I did, and I can stand gut surgery, it smells bad and all that. So he loved general surgery and I loved neurosurgery. Well, as fate would have it, during the war, Joe was assigned to neurosurgery, and he became a great neurosurgeon in New York, as even his biography has been written, and so on. So he didn't get his way, but I did get my way. I wasn't sure I was going to be able to make a neurosurgeon because my hands weren't were sort of clumsy, and I hadn't ever thought of doing anything much of that delicate nature with my hands. But I had only alternatives were neurology, psychiatry, and neurosurgery. Well, neurology in those days, before there was all this good chemistry, couldn't do anything except make diagnoses. Psychiatrists, I could never sit still long enough to be a psychiatrist and listen to people all day long, so that left neurosurgery. So I became Paul Bucy's first resident and wrote up the residency and got it accredited, and asked him after 9 months or so meanwhile I'd set up a woodworking shop at home, started using my hands a lot and made tables and lamps and chairs and things. And so by the end of the year, toward the end of the year, or maybe it was the second year, I've forgotten, I asked him, do you think I can make a neurosurgeon? And he said, well, I'll tell you the answer in about a month. And I said, oh. And I said, yes, I'm going away for the month to have a vacation. You take over my practice. I said, what? And I did. And I got through the month. And I did the neurosurgery for that month, and then I felt secure enough to go ahead and became a neurosurgeon.
What was it like to train in those days?
Well, I told a story a little while ago that people like Percival Bailey, for instance, who were apprenticed to Harvey Cushing, there was a rule for Cushing's residents that their wives or playmates or whatever had to live with farther than 300 miles away from Boston. In my day, it wasn't quite that bad. I did have a home, and I was married by the time I became a resident, and my wife could live out in Elmwood Park while I was training at St. Luke's Hospital. It was only about 20 minutes, half an hour away. But we were on duty 24 hours a day. From day one we took the residency till we left it. With internship and 3 years of residency, that meant 4 years essentially of living in the hospital and maybe going home for a few hours or a night occasionally if everything was fairly quiet on the service. But it was, well, there were some war years involved, and so I trained not only in neurosurgery but also took over the neurology and psychiatry residencies at the same time. And so we were kept busy. And I remember neurologists work reasonably intelligently and slowly, not like neurosurgeons who go in there and say, we've got to do this, we've got to do that. So I would go in, being the resident in all services, I'd see a brain tumor case one afternoon. I'd schedule her in the operating room for 2 weeks hence, the first opening. The neurologist would, go ahead and try to figure out what was wrong, and about 2 weeks later he'd say, hey, that's a brain tumor, and I say, yes, I have her scheduled for tomorrow afternoon. I wasn't very popular, let me tell you, with that kind of procedure, but that is how I did manage all three. And I used psychiatric patients for babysitters for my children, and it was quite an interesting time.
What were your teachers like?
Well, very different. Eric Oldberg was the son of a conductor, and he trained me in the operating room that when he came in like this, literally, when the downbeat came, we started handing instruments to him. No talking allowed. He could talk, but no one else in the everything was done by signs. This was hemostats, this was scissors. I couldn't do that right now anymore after Washoe bit me. But everything was signs. This was a scalpel. Very easy, iconic signs, but it was all done like that. Paul Bucy was a superb neurosurgeon. He had sort of stubby fingers. You'd never think of those hands as being, but tissue never was damaged. You really have never, I owe all of my subsequent skill, whatever, to Paul, because he really trained me. Just watching him, again, you can't talk about these things. It just, the way he did things made it possible for me to be able to do it. And we had a very good easy relationship.
How did you happen to go to Tennessee and to Jacksonville?
I don't think I should say this. Well, there are two reasons. One was that I was looking in due time to move to a place that didn't have hay fever. So I had to move either north to Duluth or south to Florida or someplace like that. And so I was looking away, and also Eric Olberg made everybody sign that they wouldn't stay in Chicago, which I had no intention of doing anyway. I didn't sign, and he didn't fire me, but I didn't want to stay in Chicago. My father had a practice in Chicago. I could have taken over Northside Hospitals, but that was, you know, you don't want to take everything from your father. You want to be independent. So I was looking for a hay fever free place. But there's another thing that I really shouldn't say on, but it was well known as go south to make your mistakes, was a saying in neurosurgery. So I went south. I'm sure I made some mistakes, but that was our view of the South in those days. And Memphis was, there was an opening with our Eustace Semmes, whom we used to call Useless Semmes, and we had a good time. But he taught me the dandy techniques. I was trained according to Cushing, and we fought constantly. I mean, I learned his techniques, but there were so many things that I felt we were doing better than, and you know, we had it out every day. Also, I integrated the office, which didn't sit very well, and did things like that, which, I mean, I really didn't last very long. I was there for less than a year, and then I moved on. It wasn't like Memphis today. The hospital, I remember crunching over cockroaches on my rounds, and it was really quite primitive at that time.
And what about Jacksonville?
Jacksonville was much better, but still, I again integrated the office, and that was again looked on, and I called the black nurses Miss, and I was chided at every move for what I was doing, and this didn't sit well, and but I got along pretty well with Lyerly, who with Poppin devised the superior lobotomy approach. That's one of the reasons I went there, and the other was that Yerkes labs were right around the corner. So I went to the Yerkes labs on my days off, Saturday afternoon, Sunday afternoon, and Wednesday afternoon. And I took over everything on Thursdays and Sundays when Lyerly took off. So that's how we worked. I was given a lobotomy ward to do. I didn't do one piece of surgery. I tested the subjects. By that time, we got to be good friends, and they got cured by just talking to them. You know, it was like that. We had no psychiatrists or neurologists in Memphis at that time, and we had one neurologist who part-time practice of psychiatry, and of course no clinical psychology at that time.
You have, you talk about being third generation away from Harvey Cushing and being at the Yerkes Institute, and you've had an opportunity to see really two fields related, but sometimes not so closely related, evolve tremendously, almost from their beginnings to the point that they are today. Can you speak a little bit about what you think may be some of the most significant developments in the area of behavioral neurology, should I say that, or physiological psychology, some of the major differences, the major developments that you've seen occur over these years?
Well, I think these fields, as you point out, are beginning to come together in clinical neuropsych. Clinical neuropsychology, for the first time, you have people who listen to each other, whether neurosurgeons, neurologists, behavioral psychologists, cognitive psychologists, psychiatrists. In the talk I gave today, I mean, psychiatrists are always interested in consciousness. That's what they deal with. And actually philosophers are getting into the show too. So things are coming together. And they were separated for a long time. I think the behaviorist revolution was a very positive one in the sense that clinical neurology dealt, I mean, the way I was trained, I mean, we asked the patient, we talked to the patient, but we had no tests, nothing quantitative of any kind. Even the things that Luria did, which were an attempt at least at doing some were an innovation. You know, do you touch your tip of your nose, your ear, right ear, and then your left kneecap? That already was an advance over what we did in clinical neurology, where we just did the neurological, no tests of behavior. So I think that is a major advance. In neurosurgery, of course, our techniques, I mean, just the diagnostic techniques, we had to be much more invasive with ventriculograms and encephalograms and things of that kind. The EEG, when I went to Jacksonville, I bought a small EEG to carry with me. It was about this size, one channel Garso thing, but it was better than nothing. And I used it especially when we had things such as temporal lobe epilepsy and things of that kind, where you really have differential diagnosis and have difficulty in making the EEG isn't all that good either, but at least it was better than nothing.
One of the reasons some would claim that the fields of psychiatry, psychology, neurology, neurosurgery can come together at this point is that the basic science that they can now relate to in a common way facilitates that. The methodology, some of the techniques that you've employed, and those kinds of things. Can you point to any particular laboratory technique or procedure that you think may have contributed most significantly to this evolution, this opening up of the brain in a way that allows people to really consider the mind as a manifestation of the brain?
Yeah, don't call it the mind. It's minding.
Okay, right, yes.
Right. I think the behavioral analysis, the experimental analysis of behavior, I think that technical behaviorism, as it's called, I think was a tremendous stride forward, and it took quite a long time to get. Now, the second major thing is the application of computer technology to all of this, and with that comes mathematics and biophysics and all of that. And then the third thing, which I think is just beginning to develop strongly last 15, 20 years, is neurochemistry. But that's not there yet. I mean, we can't just say because somebody has a particular psychiatric condition, well, that's your adrenal, or it's your catechol, or it's your peptide, or this or that.
What kinds of things did you concentrate on in the different places you were located? What did you do at Yerkes?
At Yerkes, the first step was to try to take the then silent areas of the brain, they were silent to experimental analysis, and try to figure out what they were doing. Lashley had tried and found nothing happened. Other people had found nothing happened. So I began to do, using behavioral techniques and fairly large lesions to start with, but subpial resections, not just gouging out pieces of brain, but very carefully anatomically delimited thalamocortical, the cortical part of the thalamocortical field. By taking that out, I got very good results within about 5 years. I was able to show that there were large sectors in the posterior part of the so-called association area, which were not associative at all in the usual sense of the word, of associating sensory things to each other, but had to do, were sensory specific. And I discovered the ventral part of the temporal lobe being visual. That was always thought to be auditory, and that turned out to be visual. Superior temporal was auditory. The superior parietal, posterior also going over the medial surface into the cuneus, that essentially was somatosensory, discovered where the taste area was, anterior to the auditory, the primary taste area, and then the more associative or higher order taste areas in the temporal pole. All of those discoveries came in the first 5 years at Yerkes and a few first years at Yale.
Who were your colleagues at Yerkes?
At Yerkes, I had Bob and Josephine Blum, who were graduate students. And Lashley was, of course, it's hard to say. I was a full-fledged neurosurgeon. He wanted somebody to help him out, but he also challenged everything I'd ever learned about localization of function. So we had a great time basically challenging each other, and I started with chimpanzees and monkeys then to work out these localization things, which Lashley never believed in. I never could really convince him on that, but he convinced me sufficiently so that I now say that he's right about certain kinds of things, such as a distributed memory function. So certain things are distributed in the brain, other things are highly localized, and we got to distinguish which is which. All of that was that first period.
And then you went from there to Yale.
And I continued that, but started very seriously to do the second step of my program. And that was continued there and at the Institute of Living. I kept teaching at Yale while I was at the Institute of Living. And I had a laboratory at Yale. I kept that in the sub-basement of the physiology department there. The second stage was, given, let's say, we took out a piece of the temporal lobe, the inferior portion, and we got an animal who no longer distinguished between red and green in an instrumental fashion. It just behaved essentially randomly. Does that mean he's colorblind? Not at all. It might not. So the second part of the program is taking all of these behavioral techniques, which were the breakthrough, to allowing us to localize function and in this part of the brain without damaging the primary projection, thalamocortical projection area and all that. But then we didn't know what we had. It's like a Babinski sign. And I used that term, in fact. I said, we had the Babinski signs, but we didn't know what they meant. And so this whole second part, which went on until I left Stanford, really, is to try to figure out what the tests meant by taking the tests to their extreme and showing where their limitations were and trying to figure out, and I didn't have to do this alone, other people and all my students kept doing this, like the blind side studies that I talked about a little while ago with Weisskranz. Well, what do the tests mean? What do they really indicate about brain function and about mental function? And that went on. And then when I went to Stanford for the third stage, what I then did was to start looking at the parts of the brain that we'd found. How did they do what it was that we were testing? How does the inferior part of the temporal lobe function? What are its connections? And we still have some problems there. Mort Mishkin, one of my students, for instance, is very, very much into the idea that things go from the primary visual cortex over to the perivisual cortex, and then in steps down to the infratemporal cortex. But I've taken out all that intermediate cortex in radical disconnection so that not a cell is left. And of course, to do that properly, they do invade the radiations and all that. But these animals can do all the discriminations that infratemporal cortex lesioned animals can't do after they. So it can't be a transcortical kind of stepwise thing. It's got to go down into the pulvinar up or into the basal ganglion up or whatever pathways, but it's not cortical. And back in '54, I suggested that in fact this part of the brain may work downstream as a place where it just has to be triggered from some kind of, oh, this is visual, okay, now you work downstream to organize what is coming in. And then we spent 20 years showing that in fact from this so-called association cortex, which is sensory specific, however, you do get things operating down into the primary projection areas, changing what's going on at the lateral tunicula and even as far down as brainstem and retina. So when I'm thinking something that has to do with vision, I'm actually changing what's going on in the retina.
You talked
and
about
cochlea as well.
I talked about that in at least one paper that I remember reading. You were describing the relationship between perception, emotive behavior, motivation, and emotion, and talked about the fact that simply by perceiving, because of reciprocal relationships, there was a reflexive, as I understood it, emotive portion to that that allows one to essentially, what's the word I wanted? Is consciousness?
Yeah, to experience something, even feeling-wise,
Yeah.
and vice versa. When I have certain feelings, if someone you're in love with touches you, it feels very different from the same stimulus given, let's say, with a mechanical stimulus, or even a friend of yours who touches you that way. I mean, we do. These parts of the brain are very highly interconnected, and one of our jobs was to show the connections, not only anatomically, where you can show almost anything's connected with anything, but functionally connected using electrophysiological stimuli and doing things like doing recovery cycles and showing changes in the recovery functions and so on and so forth.
It was almost as if you turned things completely around. The sense organs were, in a way, the end organ. They were on the afferent end of things. And as a result of that, people modified their reality based on their own experience of it.
Yes, I got a citation from I think this was the one from the Society for Biological Psychiatry, for showing that the basal ganglia actually are not only the readiness mechanism for our muscles, the postural set, but they change our sensory set.
Mm-hmm.
They really change what's going on out in the sensory. And the cortex, of course, does too, through the basal ganglia.
Neurosurgeons might not be familiar with the Institute of Living. Can you describe what that is?
It's a mental house. It's the old Hartford Retreat. A man by the name of Burlingame decided to make it into a wellness place instead of just a retreat. And so he called it the Institute of Living, and then he built a building which he wanted to be a research building. And he put me in charge. And then he died. And then we got Frank Braceland in there, and Frank Braceland said the day he got there, he said, I don't like your kind of work. I voted against it in Washington all my life. I don't think you should be operating on monkeys, and that's not going to tell us anything about people anyway. Goodbye. And I said, yeah, I'm not leaving. I said, I won't cost you anything. I'll do this all on grants, but I'm not leaving. I built the lab myself, essentially, put the cages in, painted the walls myself. You know, I'd spent a year and a half by that time setting up and getting Michigan and Wisecrantz and all these people working with me. And I said, besides, you can't fire me. I said, you can't afford to. The Institute has a bad enough reputation as it is for firing people, especially in science. You'll never recover. So he looked at me, he says, and I stayed. And we hit it off on that basis, sort of, but he taught me a lot, too. I did learn a lot from Frank Braceland.
And you work with Fulton.
But Fulton at Yale. He got me to Yale. That's a story, too. The lobotomy procedure was based on 2 chimpanzees that Fulton had operated on. And but he presented this at the International Physiological Congress. I think it was in Portugal, actually, and Egas Moniz heard him and devised the lobotomy procedure for humans. Well, while I was at Yerkes' lab, I took off frontal lobes carefully and didn't find what Fulton found. So when the topectomy procedure was going, I had to be in on that. Fred Mettler, I'd corresponded with him, invited me up to the first presentation of Columbia University of the topectomy, where they did careful removal. Larry Poole did all of those. And I got acquainted with Larry at that point and Fred Mettler, and had a wonderful time. Then I hopped over to Yale, and I tackled John Fulton. I said, I don't get what you get, snotty little guy that I was. He says, well, he said, what do you think it is? I said, I have no idea. What did you do? And he gave me his protocols. He says, go to the library and find out. I'll be back take you to lunch. So he came back, asked me politely, asked, did you enjoy reading the protocols? I said, very much, sir. Do you know what the difference is between what I did and what you did? I said, yes. I didn't get any brain abscesses. He had a brain abscess on one of them. The other chimpanzee did exactly what my chimpanzees did, one of them. The other one had a brain abscess, Becky. Lucy was okay, was just like mine. Becky was the one who showed the emotional changes and all of the other things in dramatic form. As I say, I was a snotty kid. I learned later from Luria something that I said the same thing to Larry. How can you find anything about the frontal lobes when this big tumor is doing all these other things? You got increased intracranial pressure. He says, if you're careful and you know what the other parts of the brain do to some extent, you will find in caricature what the frontal lobes do, because the other parts of the brain can't compensate. You got to be careful. You've got to be wise. So it really turned out that Becky did teach us a lot about frontal lobe function, but I wasn't going to take, dirty old operation. What happened was Fulton was showing off, and he had Harvey Cushing, a few other people there while he did the surgery, was showing everything, and then the chimpanzee got a brain abscess later, but it recovered. But then on autopsy, they found a beautiful encapsulated brain abscess. So he said, do you want to work here? I said, sure, I want to work here. Paul Bucy told me if I ever want to do any physiology, your laboratory is the one to come to. Besides, it's your book that gave me an A++ in Gerard's course. There's nothing I'd rather do than come here. Fulton then saw my bibliography of one paper, which I'd done with Bucy, which showed that the cortex controlled the autonomic nervous system. Little oligodendroglioma that we took out that I talked about earlier. And Fulton says, oh, you believe in cortex regulating the autonomic nervous system? Yes, sir. Well, I got the job. I mean, it took them about 4 months to get money, and I went to Yale, closed down my practice, and gave a talk I had scheduled at the Duval County Medical Association. I said, I'm going to Yale. I have to give it a month earlier. Do you mind? Gave that, closed up my practice, and up to Yale.
What was Fulton like?
I didn't see all that much of Fulton. He was peripatetic, a defender of the faith. I mean, really an intuitive person who had the right intuitions. Somewhat sloppy on the detail, like brain abscess, who cares? Like if you read the book carefully, you see all kinds of contradictions on the same page and so on. But he had the overall view, and beautiful. 2 days after I got there, in fact, I had to go a little early because he said he's leaving for England. And I got a letter. I sent him a progress report on the project every month. And he wrote back about how his diabetes was going. He said, I have a new cure for diabetes. It works like magic. Champagne and caviar. And I mean, this is John Fulton. I mean, he's just a most delightful, wonderful colleague, father figure, and everything rolled into one. When we first did the electrical stimulations and showed limbic control over the autonomic nervous system, we had a terrible time getting that published. Even Nobel laureates said all we were doing is stimulating dura, and I knew damn well we weren't. We're stimulating amygdala and perimygdaloid cortex and cingulate gyrus and all that. And John Fulton defended us right down. He published the things and got them into the literature.
How did you happen to move to Stanford?
I tried to stay at Yale, and I became director of the Yerkes laboratory following Fulton, following Lyerly. So I became director there. The president of Yale University sold the Yerkes lab to Emory University, and I didn't want a job at Emory. I tried to get the lab moved to Yale or Harvard. Lyerly had a professor at Harvard. Well, all of that mess during the 50s finally fell through, and I had my choice to go to Emory or to stay at Yale, where I had sort of an ambiguous, I had a lectureship but not a tenured professorship. So I started looking for a job, and to make a long story short, I got an invitation to go to the Center for Advanced Studies at Stanford. I had a fellowship, what are they called, a Fulbright fellowship to go to Cambridge at the same time. So I had to make a choice. I went to California, and they offered me a job at the end of the year, and I stayed.
Who were you working with there?
The people who got me the job were Jack Hilgard and Bob Sears in psychology, but they put me in the medical school, and I got tenure in psychology, so I had tenure, and but my lab was over in psychiatry. And Tom Gonda, whose father I knew and whose mother knew me when I was 4 years old, and so on and so forth, was temporary head of the department at the time, and so they snuck me in.
When did you start working on consciousness?
Oh, that really, the first published paper where I said we have to take all of this into consideration was the book Plans and Structure of Behavior, and then in '62 I make a very strong case for this in the Sigmund Coach's book, series of book called Psychology's Study of a Science. He had a whole series in which all of us wrote chapters.
1971, when you, right around that time, when you began to talk about the holographic theory of...
Well, actually, 66 is my first published paper on it. 71 is when my book came out, Languages of the Brain, which one of the languages is the holographic language.
Can you talk a little bit about what led you to expand on your findings in the laboratory, the findings of others as well, to put this together as a theory or an overall description of what you were seeing?
Well, interestingly enough, it had nothing to do with the laboratory. The laboratory findings have always gone independently until quite recently. Now, the theory is far enough along, and one of the slides I showed earlier shows how really you can show the theory, if I can use that word, mathematical modeling as a theoretical frame can generate experiments in the laboratory. But most of my life I was just poking in there the way Claude Bernard did. He asked nature questions. And I do not really approve of the way psychologists go about studying their science, which is not the way Skinner or the behaviorists did, but of hypothetico-deductive, that you make hypotheses and test them, and then it either confirms or disconfirms the hypothesis. Nobody ever looks at the thesis out of which the hypothesis came, and so on and so forth. No, we really, everything was generated directly from the findings in the laboratory. I made the large removals trying to find out what agnosias were about, essentially, or frontal lobe lesions, lobotomies were all about, and found something. And then I pursued the findings. And the holographic thing comes really out of the clinical studies that showed that memories aren't, individual memories aren't lost, and we then found that also with smaller lesions in the brain, that individual engrams or memory traces are not lost. That means it's distributed. And so Lyerly and I had this problem, essentially, we talked about over the years with Wolfgang Köhler, Karl Lyerly, Paul Weiss, how does the nervous system operate in the non-localistic way? Sure, we know there are connections, but that's not the whole story. There are what Köhler called field effects, or what Lashley called interference patterns. And it wasn't until Jack Hilgard one time asked me what I thought about the new ideas and perception about everything being made up of spots and then lines, what I now call the Euclidean approach, which Dave Hubel and Torsten Wiesel got their Nobel Prize for. I said, it won't work. When I look at you, I see your face immediately, and I can see it in this angle and this angle and so on and so forth. There is no way you can put all this together from spots and lines and surfaces, and that even if you do get things like grandfather cells, they essentially are nodes in a network because they respond to other things as well. They don't respond just to faces. The hand cell, the famous hand cell, responds to low spatial frequency, and I trained one of those cells to respond best to green hands, and green spatial. I mean, these are not, the way it was stated wasn't right. Well, so Hilgard, having to write introductory textbooks, said to me immediately, he says, all right, you can have that luxury of not believing. You've disproved Köhler, which I had done with my aluminum hydroxide cream studies. You don't believe Hubel and Wiesel. What do you believe in? I said, nothing. I don't know. And I took it back to my lab and talked to people about it. And then I said, what we could do here, we could think about Lashley's idea of interference patterns. We know Köhler's wrong. We don't think, the texture problem, for instance, is impossible for the line detector notion. If I have to scan every line on your hair, even if I do it in parallel, that whole thing, the whole business of texture won't satisfy it. So let's look into Lashley's idea of interference patterns, because at least we don't know that it's wrong. We haven't a clue as to what he meant. Lashley didn't have a clue. I talked to him for months about this stuff, and he finally wrote a retraction. Says, I don't know what I mean by interference pattern. Well, within a week, an article came out in, first Nico Spinelli found an article of John Eccles, because one of the problems was, what is a wavefront in the cortex like? What's it caused by? What would that mean? An interference pattern has to be interference among wavefronts. Found an article of John Eccles on neurophysiology of imagination. And in it he says, we do study synaptic potentials and all of that at the end of axons, but we only study one at a time. When an axon comes down to dendritic field, it splits, and you have a lot of these presynaptic potential occurring at one time. That can be thought of as a wavefront. And I thought, how stupid. For 10, 15 years, we've been trying to figure out how a wavefront could be created in the brain, and it isn't the kind of thing Köhler was talking about. What's left? And Eccles had it right on. It's not, you don't have to even think of it as a wavefront if you don't want to, but you can. It's a lot of presynaptic potentials, and they set up postsynaptic potentials. They are graded potential changes. And they can interfere. One axon comes in this way, another, you got to interfere. So within a few days, we had an idea of what Lashley might have been talking about. He got the idea from Jacques Loeb and other people early in around 1900 who said that like embryogenesis, you have these force fields that are being created, which have lines, force lines. That's what he was talking about. Well, anyway, so that was the first step. And within a week, my current issue of, this is about 64, of Scientific American came, and in it was Leith's stuff on holograms. Set of interference patterns from which you can reconstruct a perception, an image, and it's distributed. It solved the distributed memory problem. It solved the problem of these things being relatively fluid in the brain so that I can move around and still see you, and it solved the problem, the distributed problem, the fluidity problem, and that you could get back a perception from the interference patterns, which Lashley never had. So in one stroke, it all made sense, that it's something like that going on. As a metaphor, it was perfect. So I began to study holograms. I had to learn interference patterns. I learned math. I had to learn, I met Gabor in 1968, and we talked about it. I talked about Fourier transforms with him. Says the brain doesn't work on a Fourier transform. It's not, that's the basis of it. That's not the whole thing. But the guy never told me that he'd invented a better way. I had to find that out for myself. And he was that kind of a person. I heard from somebody at Virginia Tech a few years back who was a friend of Gabor's, that Gabor once said, if anybody's going to figure out how the brain works, Karl Pribram. I felt just wonderful. But you know what that man put me through, he and also our friend Don Mackay. I would talk about Fourier transforms and holograms, and they said, too simple. It isn't going to work. Never did he tell me that he had figured out in 1946, before he did the hologram, that of these Gabor functions, that the brain can work in terms of quanta of information. That's what, but he never told me, but I did find out. And one of my students found out even before me and published a paper after he left. He went to University of Tennessee, in fact, and I didn't know what the hell he was talking about. It was all math. And it took me another 5 years to learn the math and understand. I got a mathematician, Eloise Carlton, working with me, and that's that other paper you have. We finally got published. We couldn't get it published here, so we got it published in Europe. And then the book. So it works. It works. And some of the things, I mean, the interesting stuff I found out. For instance, the step after imaging, which is holographic-like, you have to come up with objects. You know, it's the same object. Not even the fact that it's a book, but just that it's, and all of these different images. How do you get them together into an object? Well, it turns out at the end of the 19th century, Poincaré, Helmholtz, and a man by the name of Lee had a set of correspondence. Starts out Helmholtz saying, I'm interested in objects. Poincaré, the mathematician, saying, oh, objects are relations. Why don't you figure out how to make objects out of relations, like group theory or something like that? Helmholtz writes a paper, group theory. Lee writes Poincaré, saying, you put this guy Helmholtz up to something on group theory, but it's not the right groups. He's got discontinuous groups. Perception doesn't work that way. It's not discontinuous. I've invented a continuous group theory, and that works. This is 1885, 1890, somewhere in there. All that correspondence. One man, Cassirer, a philosopher, remembered that until Will Hoffman dug it all up, and I had invited Will to a Congress, International Congress of Psychology in Paris, and we met there. But he didn't have it quite straight either. He had group theory coming not out of the holographic things. I use group theory in the transform, in the spectral domain, and that works so simply. You get centers of symmetry around which all of this works. I mean, the whole thing just falls out very, very easily. Will at least had the group theory part straight. And and he came to my lab, worked for 4 months with us and all that. So putting all of these pieces together, what do you get? 1885, Helmholtz, Poincaré, and Lee already, and Lee groups are used everywhere in engineering, they're used in physics, they're used in thermodynamics. I mean, you know, everybody uses it, but never in psychology, never in neurophysiology. What he invented it for.
What are you doing at Radford?
Well, I've set up a lab. The building was completed about a year ago, and assembled a group of people each of which ought to go see a fellow psychiatrist here, and probably me too, trying to keep a group of innovative and creative people together. I mean, it's just, and you can't tell them, like in Syria, that you're a resident. You hold the goddamn retractor. So it's fun. It's really fun, but I have to be in there with each one of them, and each one is tremendously creative in their own right. And we've got computers, imaging computers, not imaging techniques for the brain yet. That's too expensive. We can't afford it. But good people, and we're doing electrophysiology to start with. I haven't got monkeys yet. That I have to go through enough committees, find the monkeys. I think I will get them from Bowman Gray and so on and so forth. I tried tech, they wouldn't do it for me. And so, it's setting up a lab, which is like setting up a department or setting up a new hospital. All of these things are involved. But we are recording from rats. We're getting better records than I got back at Stanford in the last 5 years already with electrodes that I brought from Stanford. Now I have to be sure that Fred Hare, who made the electrodes, can make more of them, and so on and so forth. So step by step we're looking. Now the thing that we need to know is how there's a lot of math here in the appendices. That has to be put on computers to see if it really works the way the math says. Also, we can take a few steps further in that. We can do nonlinear mathematics. This is all linear. There are little details that need to be worked out. The thing I showed you at the meeting, at the lecture, were two-dimensional Gabor functions. We've already developed, not I, but a mathematician, computer scientist at the University of Tennessee in Knoxville, Bruce McLennan, has developed a three-dimensional one, which we need badly, or we won't have time and movement into the whole thing. So he's done that. We're writing a paper saying that the way people do the parallel distributed processing things, make certain assumptions which don't fit with the brain. We're writing a paper together. We're trying to straighten that out. So there are a lot of loose ends that need to be. And then the fourth part of my program is to tie this to human, back to, where I started. It's nice to work with monkeys, but I'm really interested in human consciousness, how we think, how we feel, pain mechanisms in humans, trying to figure out under hypnosis where in the evoked potential, which particular segment of the evoked potential, which component is involved in hypnosis, and we pushed it back to the end, about 200 milliseconds, all cortical, but is it 200, 100 milliseconds? If so, where do those components originate? And so on. Some of that is in the 10th chapter here. So, but it's hard. I, for 10 years, applied for grants to find out about components, evoked response components on animals. I never got the money. Everybody says, yes, this is terribly important, you got to do it. But you got a little glitch here, maybe in the way you wrote it up or this, and then comes back a pink sheet saying, well, you're 68 or 70 or whatever I was at the time, and we got to give young people a chance. I said, who the hell's working in my lab except young people, and so on. So you've got all these hurdles to overcome, which you, I'm sure, well know we have in every field, but I've been given a long-term appointment so I can stay, and I couldn't do that if I had an appointment, which I was offered several for a year at a time, maybe 2 years if you're a good boy, kind of thing. I mean, that just doesn't work.
One last question. What do you think about the new tools, MR, PET scanning? Do you think that they are going to enable us to make breakthroughs?
Oh.
You see things in the future from them?
We're always wedded to our technology. I mean, microelectrodes, what we do today, I mean, the EEG, as I said, there were 2 EEGs, one at Northwestern, one at the University of Chicago when I started out, and at the University of Illinois where I was going to get a fellowship with Percival, we didn't have one. And he went overseas because we couldn't get one. Nobody knew how to build one. I used the first commercially available oscilloscope. We had a room half this size to run a 3-inch scope before that. And Grundfest developed the first, Dumont put out the first commercially available. Grundfest got the first, I got the second, and we did evoked potential studies and showed that this business of reverberatory circuits between thalamus and cortex was all nonsense, that they wandered all over the place if you could, measure them simultaneously by splitting a beam. And I mean, there are just innumerable things like that. We're always dependent on our technology. And the beauty of my current setup is I have 3 people who come out of physics and engineering, one of whom, they're all from China, one of whom was also in medicine, and Peter Kugler, who's a psychologist, but he got his degree in physics, and he runs all of that, the analysis end of things. And I mean, these people are incredibly good. So we hope to have that kind of technology is already better at our place than it ever was at Stanford. And, I mean, Yale is, But Lashley and I once talked about automating testing. We couldn't figure out a way to do it. Then Skinner came along, Skinner box, and I immediately developed that into what I call a data machine, discrimination apparatus for discrete trial analysis, which I've been using since 1968. 1958. I've not permitted an EEG machine in my lab. It's computerized. The subject is sitting there solving problems, and not just, if you want to know what's going on in the heart, you put a load on, right? You don't just do it at rest, you put a load. Why shouldn't we do our EEGs at rest? Yes, but also with a load, a cognitive load. I've been trying to get somebody to build machines like this so they can get on the market for 15, 20 years. I mean, all the programs are written, everything's been done for years. So my lab's been computerized since I went to Stanford in 1959. Yes, I wish I could afford some imaging. It would help me not have to sacrifice the animal each time. I know where my electrode was by just putting magnetic resonance in, and looking at it. I don't know what that would do to the brain, but, because it is metal, but I don't think it'd do as much damage as chopping off their heads.
Well, thank you very much.
You're welcome.
We've really enjoyed speaking with you today.
Well, it's been a long and wonderful time for me. I mean, the discoveries that have been, I used to read about Admiral Byrd going to the South Pole and Amundsen to the North Pole. That was what I would have liked to have been during the ages of discovery, And now it's all in here, but it's discovering, and what we have learned. There's still so much to learn, especially on the neurochemistry side, of course, and on the physics side as well. But what we didn't know and what we now can formulate, the way we can formulate, true. In the 1885 already they knew in outline terms. Freud's project for scientific psychology already had the outlines. William James already had the outlines. They did that in the 19th century. But now with the new technology, we can spell out things in with such precision that we'll go to a whole new level of understanding. And that's due to technology.
Thank you.
Thank you.
You're welcome. It's been fun.